Hello friends, when we talk about the residual volume, the first thing that comes to our mind is about the lungs. The lungs have residual volume. Yes, of course, but this is a much bigger concept. Why do I say that? Let's understand what I mean by residual volumes for different organs in the body. We have a few hollow sphere-like organs or hollow viscous, and they receive the content. Once they are received and filled with the content, they send it outward. Now, whatever content was received by them, all of it is not sent outward. Some of it stays back, and that is technically the residual volume for that particular organ or the viscous. Why do they do that? Why not they empty entire content at one instance? It's because they need to maintain the wall tension. We are talking about the hollow spheres or hollow viscous. They need to maintain their wall tension, and for that some amount of the content needs to stay back, and therefore these organs do not entirely empty their content in one instance. Some amount of the content always stays back, and that can be called as the residual volume. Let's see the residual volumes for different such hollow organs or hollow spheres in the body. Starting with, of course, lungs, because we already are aware about the residual volume in the lungs. Maximum capacity of the lungs, that is total lung capacity, is in the range of 6,800 ml. But out of that, after maximum forceful expiration, some 1200 ml stays behind. It never comes out, and that is the residual volume for the lungs. It maintains the alveoli in a certain distended state, and for that this residual volume is necessary. Urinary bladder, another hollow sphere. Technically speaking, urinary bladder can hold up to 900 ml of urine. However, of course, that much is never possible. Beyond 600 or 650 ml, there would be a maximum urgency for micturition. But the bladder's total capacity is 900 ml, out of which after every act of micturition, the bladder is not emptied completely, but 50 ml stays back, and that's the residual volume of urine in the urinary bladder. Gallbladder. Gallbladder has got a capacity of about 50 ml, but whenever it empties the bile into the intestine, it never empties that completely. Even at the peak of phase 2 in the MMC, all the bile does not flow into the duodenum. Some 15 to 18 ml stays back even after the gallbladder contraction. Cholegogs will cause strong gallbladder contractions, and the bile will move out into the second part of duodenum. But 15 to 18 ml will still stay back. The gallbladder does not ever get completely emptied. And finally, heart. Yes, even heart has got the residual volume. What is it? Now look, the end diastolic volume of the heart is 130 ml. That means heart receives blood during diastole, and by the end of the diastole, 130 ml is filled in the ventricles. Then with next systole, roughly about 80 ml will be ejected out, which we call as stroke volume. So you noted the point that the entire 130 ml which was received is not ejected out with next systole. 80 ml, at the most 90 ml. So what stays back is called as end systolic volume. By the end of the systole, the ventricles have not completely ejected out that entire volume of blood. Some 50 ml stays back, and that's the residual volume for the heart. We don't call it residual volume, we call it end systolic volume, but it should be seen in that light, that the heart has to maintain a certain amount of wall tension. It's muscle and it has to maintain a certain amount of tension for which some amount stays back always. That's called as end systolic volume. But in a way, we can call it residual volume for the heart. After ejecting out the content, some still stays back, which is the residual volume, the volume that remains back. So this is a concept that residual volume can be applied to any hollow, viscous or hollow organ in the body. These are the major examples.